Well, certainly we'll be speaking to the Health Minister Zweli Mkhize, who has been hard-working trying to calm South Africans' fears and keep us informed about the spread of the coronavirus in the country. He joins us now in studio. Good evening, Minister, and welcome to the Full View. So the 7 new cases, or rather the 4 new cases, how does government get in contact with whoever else these people have been in contact with? Because I was listening to the press briefing and you're going through the number of new cases, and you're indicating as well that they've come into contact with such and such a number of people.
Well, the way we deal with it is that the person who is testing positive needs to give us the list of people that he has been in touch with. So what the person would then do, would ask them, where were you yesterday, in the morning, afternoon, and so on. If you went out, who did you meet? And then who lives with you, who came to visit you the day before, and we go on day by day from morning to evening, right through to the point where we think that this is the time that he could have been infective on. Then we take that list. We will then look for the contacts of all those people. Generally, you meet people that you know, or if you don't know them, but you will meet them in a place where they would be known, and therefore would generally tend to find all of those people. If it was in the aircraft, we then go into your seat and then look at who else was in the seats next to you, and then the airline will give us the details of those people, then you can find them. Then we will talk to them and say to them, someone was sitting next to you, has tested positive. Now we need to firstly take you to a quarantine, so you must sit at home, don't move out to and talk to people or visit other people outside your house. Secondly, we're going to take some tests. It's good for, that's important for your health and the health of all the others. Then we'll get more details that way.
And how effective is this self-isolation?
Well, so far, we've got no reason to fear that the self-isolation is a challenge. What our team would tend to do, they go and look at the environment, how the person is living. Is it in a situation where you think that the person will be able to keep control of who comes into the house and who doesn't come into the house, and that, in fact, they will not be mixing with other people, that they can stay indoors and not move out. If we think that on our assessment that is possible, that's what we'll do. So far, we've not found a problem with that. However, if we think that there might be problems, then we'll have to make special arrangements to deal with that situation.
Who does the monitoring then?
There is a team that does the surveillance. You've got a team of epidemiologists and a team of environmentalists and people who would actually observe the house and call the person at various intervals to find out where they are, what is happening, and so on, and therefore monitor how they live, what's happening. That's really the way that we do the monitoring. So
there's no guarantee that that person would be following the strict instructions that have been given by the epidemiologist?
Well, at the moment, we've not had a situation where there's a challenge of that nature. There are circumstances which, when you analyze, you might think that that might be a problem. In that case, there would need to be a special arrangement made so as to make sure that that quarantine is effected. Home quarantine is quite effective. It's been used in many countries, but also if we think that there's a challenge with the quarantine, we'll have to make specific arrangements that will address those circumstances.
Why can't government do it now? Why can't government say to the 16 contacts that have come into contact with one of the confirmed cases and say that you are now going to be moved from your house and we're going to quarantine you at a certain health center?
Well, they are not sick as such, so they don't need to be in a health center. So we have to understand that only when people are sick, we take them to a hospital. Before they are sick, we just observe them in their own environment. But there will be a situation where we might think that it's necessary to move people and take them somewhere else. Let me give you an example of the people that are coming from China. We will not take them to their homes because they were not there when they were exposed to the risk of infection, and they've not been to those homes. So the environment is very different. So those will put them in a place where we'll ask them to stay in one place for the duration of the quarantine period. That's the point at which we'll be able to test them and say that we want to observe them and test until we know that they are negative.
But why can't the same measures be taken even for these guys?
No, at the moment there is no need for that. But if the need arises, we'll have to consider that. But you can't upfront can't go and remove people if you think that home quarantine can work.
Yeah, because the concern is also around we as a country, as well as the WHO, has identified Wuhan, of course, as the epicenter of the coronavirus and classified it as high risk, right?
Yes.
Italy is now the country in Europe that has been hardest hit by the coronavirus. So shouldn't we also be saying that this is a high-risk country, so people traveling from this country must also follow the same procedures as people traveling from China?
Well, there was no problem. There was no problem with people who are traveling from China. There was a problem with people who are coming from Wuhan and Hebei.
Yeah.
That was the only province, not all the provinces. Yeah. Because if you count the number of people who are infected, the highest concentration was in Wuhan and Hebei province. The other areas of China, there was no restriction. And also, those who are in Wuhan, they were not kept in a hospital or kept in a particular place. They were kept in their own homes. And they were not moved up to a special quarantine area. They were all kept in their homes. Mm-hmm. So the circumstances of those that we are talking about were never really required them to be put in a special place as such. Mm-hmm. So we know that quarantine of that nature works. But let's take a situation where someone is not able to get quarantined because of various circumstances, and that you can't restrict the movement of people into their homes and so on, then that's the one that we'll have to make a special arrangement for. But you can't sit here and say you will actually get everyone out of their homes when we know that the environment is sufficient. So we need to arrange.
You don't have any guarantee that whether this person will be following the strict instructions as well.
No, it doesn't work like that. You see, all the people who were in Wuhan were actually kept in their dormitories, they were kept in their homes. There was no, and then if they needed to go and buy food, they needed to go buy food in their area because of that thing. In our case, we just say you can't go to the mall, we may have to make arrangements for you to get food in the area. So there is no problem of actually dealing with that. But you have to be specific to an individual. If one person needs to be taken out of their environment because quarantine is not possible, that's when you can do it. You can do it that way.
Is there a concern at all, Minister, that some people could argue that it would be unconstitutional to quarantine people?
No. There's no problem with the Constitution with quarantine. There is an issue of the supremacy of the protection of everyone who's got a right to good health. So if you are not well and for your own sake we need you to be quarantined, we will ask you to be quarantined. If it's for the sake of other people, we'll also ask you to be quarantined. But if you refuse, you must do it voluntarily. But if you refuse, we can actually enforce it. There's no problem in enforcing it. Yes.
What is the estimated number of people who have come into contact with the 4 people who have now been infected?
I haven't counted them. I can just look at the list, but they'll probably be very close to maybe 80, somewhere there.
So does this mean that after you go through let's say for instance the one person came into contact with 16 people,
yes,
you then test those 16 people, and if you find that there's one positive, then that person would also have to give number of people that they would have come into contact with?
That's how it works.
Yeah.
So let's say take the first person. We said today they've contacted maybe about 21 people, and then all of those 21 people will ask them to self-quarantine, stay at home, and then until we get their results. Their results come back, they're negative, okay, we'll observe them for a period. But we also have to take the history of how long their exposure was with the individual. If you meet someone who's got a coronavirus and he was at a distance away from you, it doesn't necessarily mean you'll get infected. But if there was close proximity, then we say, look, the risk is higher here. So those are the things we assess.
So does this mean that government is chasing what they call, you kick the can down the road, because now you keep on chasing people after the next because you've decided not to quarantine them? Because even, for instance, the one person who is positively infected and only tells the department of 12 people that they haven't come in contact with, during the press briefing you also said that this is based on their memory, so we're not too sure whether indeed they're giving us all the figures.
Well, I don't think we must work on doubt. You know, if somebody says to you, I've met 25 people over that period, it is after a thorough analysis that we come to the number. So it is not just a question. People must account for as much of their contact as possible. And the numbers are not the same. So with that, we actually are able to determine who are the people at risk. But now, your concern that what if someone has been forgotten and that kind of situation, well, it may be possible, but why do we worry about just one person? Because we're dealing with all of those that you can remember. So the majority of those that we can find, that's possible. Only if we think that we have remembered someone that was left out, then we know someone was left out. But to create a suspicion on a continuous basis is not what will help in this situation. What we normally would then do, there are areas where some of the people don't have to be remembered. So if we went and said, you were in a doctor's room at this particular time, then you don't need to remember how many people were there. We'll go and ask the doctor, people who came from this time to this time, we'll take those numbers and then we take those people down. So we can verify some of the instances independently of the individual. Like in an aircraft, we will know who was sitting where, so we'll be able to definitely point out as to who else was there. So most of the time you don't hit a miss. It might be a very small percentage of people where you might miss out.
Minister, what should happen first before, for instance, the area of Hilton is on a lockdown, or even Pietermaritzburg for that matter is on a lockdown? Because now I think we have about, 4 confirmed cases in that area.
Well, first you lock them down in their homes.
Yeah.
Then we know that you limit their movement. Then you go out and look for the people that were in touch with them. Then you actually ask them to also stay at home. And then you look at all of them. When you have to think about lockdown is when you get infection from person to person in an open community. So in this case, all the people that we're talking about are people that got infection from one particular part of the country. But when you're going to find people to say that they were in this particular area, everybody's just getting infected, then you can start saying, let's reduce the contact of people in that particular area.
But isn't a lockdown a precautionary measure as well? Isn't a lockdown a precautionary measure to say that now we've got the 4 cases that are confirmed in Pietermaritzburg, let's try to contain it, and we're going to contain it by locking this entire area down?
No, I think it's too early to talk about a lockdown.
So my question then is, what should happen? Is the department waiting for deaths first before it says that actually now there must be a lockdown?
No, the death is not a subject of whether there's a lockdown or not. The death is usually a question of whether the person was pricked up early and whether the disease was complicated enough, whether they were able to get treatment early or not. But when you've got infection, let me just say, you go into a school and you find that there are many kids who are infected, or you go to a workplace, there are many people who are actually infected, then you know that in this area, there are so many people that are actually affected. You can then start saying that in these particular areas, we need to actually restrict the movement of people. But if you say in this whole town, there's too much infection that's been detected, you can then talk about it like
What's
that.
the threshold then?
We don't work on a threshold. We work on the reports as people come. You can't say, we'll wait until so many people. You look at where the concentration is. The trend must be, is this a localized area? Is this a general infection across the whole town? Or what are you dealing with? So if you talk about Wuhan, the numbers were very huge in one city. That's why they decided on a lockdown. And when we looked comparatively from that province to the other, the numbers were also quite high compared to the rest of the other part of the country. It was very clear that you needed to ask those people to stay in until the virus burns itself out amongst those that have it and reduce the numbers. Then you can then
so lockdown does work?
Yeah, well, lockdown does work.
So why don't we use it?
No.
Even though we only have 4 cases, why don't we say let's lock this area down and make sure that everyone is tested and everyone is cleared?
No, it's unscientific. If someone, in this case, you don't have a basis. At the moment, you can't even prove that there's been infection from one person to the other. You've got an infection of people who came from where they came from. So at the end of the day, what we need to do is we keep assessing all these contacts. Let's assume that you get the first ring of contacts, they're all positive. You got the next ring of contacts, then you can see that if you plot that all over the city, that means that everywhere there's infection taking place. Then you know what you're talking about.
Just a final question, Minister. Are there any plans that Cabinet is considering in terms of locking down or rather closing down the ports of entry?
No.
or any travel restrictions?
Those are being assessed, and we have said that the ministers will be coming with submissions to the President and to Cabinet. Those will be discussed at Cabinet. When there are such, they will be announced.
Okay, then. Thank you so much.
Thank you.
Minister Dr. Zweli Mkhize, they're joining us for an update on exactly what is happening with the coronavirus and all measures that have been put in place. This episode